John Halbert, our CEO and nitric oxide expert. He's really, really good. So we're excited to have him.
Thank you for doing this with us, John. Thank you.
Oh, of course, no, happy to be here. And I would say if there are questions that come up that you feel strongly you want to jump in, I'm fine with that as well.
Okay.
Whatever works for you guys and the team that you have there.
Great. Thank you so much.
Thanks,
are you good to go?
Yeah, we're going to get started. I'm going to, like I said, just put us on mute for a bit. And then if anybody's got any questions, we'll unmute it.
Fantastic.
Thank you.
Okay, so we'll jump right in, and I suppose just to give a little preface to this, Donna had mentioned a little bit about your practice. I've kind of done some digging around on your site to learn a little bit more about kind of the different services that you offer and how nitric oxide plays a role in some of your patients' long-term protocols potentially. Most of the business that we do is in the integrative functional space, not as many in aesthetics, but it's something that we've always seen as a logical fit for nitric oxide and one of the areas that we really are enthusiastic about getting more involved in. And just kind of as an aside, as we think about Berkeley Life is owned by a company called Life's Too Good. And I see on your website you list the Viviscal hair loss product, and that's actually a product we launched in the US back in 2007, and we subsequently sold it late 2016. So we have a lot of experience working with aesthetic practices like yourself, and have been in the niche nutraceutical space for quite some time. So one of the things I wanted to start off with, we'll start with kind of the general building blocks of why nitric oxide is important for all of your patients, especially as they age. And then we'll touch on some specific areas of how it's most relevant for patients in your practice. Going through your site kind of and the store on your site, and I don't know as the store representative of all the products that you carry, but looking at nutritionals like Berkeley Life, I always think of it as a really good start for any practice that maybe is either not focused on supplements at all or is focused on a specific niche of supplements, because nitric oxide is a really good general product. We call it a foundational supplement purely because giving a patient optimal blood flow is a great starting point for any line or course of treatment that you choose to recommend to them. The thing that I always find the most interesting / frustrating is that nitric oxide really had its coming out ceremony, I guess, in the 1990s, when in 1998 it was awarded the Nobel Prize in Medicine for research that had been done much further back. But what's interesting is that if you asked most patients, most consumers, very few of them will be aware of nitric oxide, and even a lot of practitioners, their knowledge of nitric oxide is incomplete at best. And its role in the cardiovascular system and a healthy circulation is unquestioned. If you look at PubMed, there's about 70,000 papers that talk about vitamin C, about 90,000 papers that talk about vitamin D, but nitric oxide is about 180,000 papers. So from an academic sense and a research sense, I think there's a good understanding and awareness of its importance in the body and in general health, but that has not necessarily translated into the consumer space yet. Our feeling is that educating practitioners and educating the teams in practitioners' offices is crucial, because you are best able to understand the patient needs and how nitric oxide may play a role in their cardiovascular health and all of the things that can come from an impacted cardiovascular system. So what we'll talk about, and this is kind of as a generality to the patients that you're seeing on a daily basis, is this progression of endothelial function as you age is very common. So in your teens, your 20s, your 30s, general endothelial function is fine. You're able to expand, contract as needed, and the lining of your blood vessels is accommodating that. It really starts in your late 30s, early 40s, where you start to see the early signs of endothelial function. And as you see from the graph on the right, that timing aligns perfectly with the decline in nitric oxide in your body. So we'll talk about the different ways the body makes nitric oxide, but this graph really is common across everyone. It may happen earlier for some people, later for others, but around 40 you start to see that decline, and it continues as you age. So you will see patients coming into your office, and a lot of them will have issues that you can tie back to circulatory concerns or circulatory limitations. And a large portion of that is due to declines in nitric oxide. The good thing, and something that we'll share here in the call, is that this is very addressable. This is very fixable with diet or supplementation. And that's obviously what Berkeley Life does, but I'll talk you through the dietary elements too, so that your patients are fully aware. Just on the right for reference, for men, the nitric oxide decline happens slightly earlier. For women, the nitric oxide decline generally speeds up post-menopause, but you'll see by the age of 60 that both men and women are producing about the same nitric oxide in their bodies. So there's two ways to make nitric oxide. You'll probably be aware, in the consumer space, or maybe even in some practitioner products, they are amino acid based products like L-arginine, L-citrulline. These are utilized by the body to make nitric oxide, but generally most effective when you're in your 20s, in your 30s. The Nobel Prize winning science that I referred to was done on arginine-based products, but it was done in teens and people in their early 20s. What we find is that as you get older, you're not able to convert the arginine into nitric oxide. So it's not that you don't have enough, it's that your body is unable to make the conversion due to some enzymes that become uncoupled. What we focus on is in the right-hand side. So this is really, I always find it fascinating to explain it, but the idea is that your body, you consume nitrate in your diet. So that can be through spinach, arugula, bok choy. I can't see what you're eating, but maybe some of you are consuming some leafy greens. Within those leafy greens are nitrates, and your body will absorb those nitrates into your bloodstream. It circulates that nitrate into your salivary glands, and in your mouth, the nitrate converts to nitrite. You then swallow that nitrite, and then your body converts it into nitric oxide. So that pathway remains intact for as long as you live. So as long as you're giving your body nitrates in the form of diet or supplements, you're able to make nitric oxide in the body. So that, again, is what we encourage people to do. But as you probably are familiar, the standard American diet is, I wouldn't say devoid of nitrates, but very, very low in leafy greens. So the majority of patients that you test, and we'll come to the test in a while, they will show very low or depleted levels of nitric oxide because they're not getting enough nitrate in their diet on an ongoing basis. So what types of foods, again, do contain nitrates? So you have your arugula, bok choy, celery, lettuce, etc. Generally leafy greens. If patients are willing and comfortable to go the route of dietary change to improve their nitric oxide levels, that's fantastic. We've found that the compliance with that type of dietary changes is not always as good as we'd like it to be. So oftentimes they will make dietary change while still supplementing it with a nitric oxide product like Berkeley Life. But it's always helpful to give patients the full understanding of how they can take action, and there's no requirement that they take a product like ours. Like many supplements, it is possible to do it through your diet. It just might be more convenient and efficient to do it through a formulation designed to deliver the nutrients that they need. And one other thing to be aware of is that the source and how the way it's grown of vegetables can cause a lot of variance in how much nitrate gets delivered. So I always call attention here to celery. Celery in Los Angeles has about 2,651, I think it's parts millimoles worth of nitrate. In New York is about 88. So you could be doing all the right things, but just based on the sourcing of your products, you may not be getting exactly what you need. So some of the common applications of a product like nitric oxide, how I always emphasize practitioners look at this is to think of it first and foremost as a circulatory product. The reason we don't work directly with consumers on a product like Berkeley Life is it's hard to always educate them on all the different ways it could be beneficial to their health. So if you are doing a patient consultation, it's looking at, okay, how might impacted circulation be causing the symptoms that this patient is coming to visit us for? And in that case, you then would, if there is a logical tie-in, you do the nitric oxide test and explain to the patient how circulation or improving circulation might at least play a part in their long-term patient protocol. This is something, and I try not generally to go as broad as this, but this statement is very true. And if you look online and you look at nitric oxide plus any application, you'll generally find some clinical research on its efficacy. And this statement then just talks about how it plays a role in nearly every physiological process, be that circulation or as a signaling molecule. I might just jump into the wound healing piece first. So I'd done some research on this previously for a similar practice that we worked in, and I was looking really at how nitric oxide and the subsequent improvement in blood flow can really support patients as they recover from surgery. So we'll walk through these bit by bit, but they all come back again to the ability to deliver blood flow to the part of the body that is recovering. So if we think of it like this, it's not only the major veins and the major arteries that suffer from that decline in blood flow as we age, it's also all of the microvasculature, that those veins that are have the thickness of a human hair, they all also decline in their ability to deliver blood. And if we think of the importance of blood flow at the surface of the skin, it's what does all the waste removal, it's what supports collagen creation, it's what it maintains elasticity. So as we age and we see high blood pressure levels, we see peripheral circulation issues, we also see a decline in the elasticity of the skin or the general health of the skin, and at least a portion of that is tied to the ability of the body to actually deliver blood flow to that area. So when we think of a patient and trying to optimize that patient for post-surgery recovery, improving their nitric oxide level will help them post-surgery with oxygen nutrient delivery, the inflammatory control. So as the patient is recovering, they'll see inflammation in and around the area where the surgery occurred. By delivering blood flow to that area, you're improving the white cell presence in that area. Nitric oxide naturally scavenges inflammation, be that in the gut or be that whatever in the body needs it. The edema and swelling control, this is due to the lymphatic system, and the lymphatic system requires adequate circulation in order to operate correctly. Pain management, I would say when I was doing the research on this is more related to the ability of the body to, if you're taking pain medication, in order to that to be effective, it has to be delivered to the area that needs to go. In order for it to be delivered, it works through the blood system, so you need to have the blood flow to that area. And lastly, healing and scar formation. That actually ties back a little bit to, the healing is the white blood cell delivery, but the scar formation comes back to the ability of the body to create collagen and maintain collagen in the skin and in the specific area the patient has had the surgery. So
hey, John,
yes.
Hey, can I ask a question? It's Frank Brown. I'm a plastic surgeon. So,
yes.
How do you measure cause and effect? So if we're talking to patients and we have to, we want to try and back up what we're saying. Many nutrients and supplements affect all of these areas.
Sure.
So how do you grade or judge what the nitric oxide is doing, or whether you're deficient or not, or if supplementing it makes a difference? How do you, because there's so many variables that affect all of those functions, where can you tell a patient you can, improve or say it's actually making a difference, or maybe higher levels would be better?
Sure. So we have a number of measures. I'll kind of break it into multiple parts. We have a diagnostic test, which I'll come to. And what the diagnostic test is doing is it's giving the patient an indication of their nitrite levels. So your nitrite levels in your saliva are an accurate precursor of nitric oxide in your body. So as an initial step, at least, that is identifying for the patient of saying, okay, you're 40 and above, based on everything we know about nitric oxide's decline. If you're not getting nitrite in your saliva, you're not producing nitric oxide in your body. In terms then of validating the efficacy of nitric oxide and also the product specifically that you're recommending, we have done clinical research. We've shown improvements in endothelial function after a course of taking Berkeley Life and nitric oxide. In specifically, I suppose, understanding the cause and effect in terms of a patient example where they're post-surgery, and how can you validate the patient that, yes, you've improved 10% better because you took this product, is difficult, because what we're delivering here is systemic nitric oxide. We do have a topical product, which it is easier in some senses to show what is benefiting versus not, because you can apply the topical product to maybe a portion of the scar, or you can apply it to a specific area of the skin and monitor the changes in skin tone in that specific area. But when you're delivering a systemic product like nitric oxide, that is challenging. The only thing I would point to is if there's other areas of endothelial dysfunction that are manifesting for the patient. So it's potential that you have a patient that comes in for a surgery and has maybe blood pressure concerns. So, you know, you're recommended the product to optimize for post-surgery recovery. But if you're monitoring their blood pressure in tandem with that, you'll be able to show them the improvements that can occur there. Sexual function is probably the most common use case for our product, not because it's what it works best for, it works really well for it, but it's because that's what people are motivated by. So a lot of times patients over the age of 45 may be seeing sexual function concerns. They start taking the product and notice an improvement in that. So there are other ancillary biomarkers you can look at that, you know, while they're not directly related to why they come to your practice, they are things that are very noticeable for the patient when they see it improving. Does that help answer your question?
Can I ask you, what is the half-life of the oral supplement? How long can you expect it to be, you know, making a difference when you take a dose? And how often? So for a surgical patient who's going to have a big procedure, should it be dosed more frequently, or is there a maintenance dose schedule and one maybe for after a procedure? How do you look at that?
So the half-life of nitrate is between 6 to 8 hours. The half-life of nitric oxide, because it's a gas, is milliseconds. So what we have to ensure is that we're delivering enough substrate so the body can continue to make nitric oxide for 6 to 8 hours in the body. So our general recommendation as it relates to dosing is 2 in the morning. And then at lunch and dinner, if the patient is able to consume just small portions of leafy greens, that will maintain their levels throughout the day. You know, there are patients that are just so averse to consuming leafy greens that they will take additional doses in the afternoon to maintain their levels throughout the day. But it really is up to, you know, each patient, a case study or patient example. As it relates to kind of how you would dose it for patients going into surgery, like how I've often recommended is to say, okay, when they have their initial consultation and maybe they agree to, you know, the treatment or the procedure, starting them on it then, and then at least maybe a month to 6 weeks after the surgery to ensure optimal benefits. But it kind of comes back to the point I made earlier, is that it's beneficial for that acute application of pre and post surgery recovery. But logically, if the patient is of a certain age, they need to maintain their nitric oxide long term. Whether they want to do that is up to them. But if it's explained to them fully, you know, most of them will then continue to take the product or make the dietary change. But I would say at least as soon as they agree to the surgery or confirm they want to do it, to about 6 weeks after is probably the optimal window to maintain their nitric oxide levels.
Is the absorption, orally, the absorption, is it better after a meal for because of fat solubility or not, or should you take it on an empty stomach, or have you measured absorption to see when it's optimal?
So on the product, you'll see it says with food. That's more so just to ensure that it's tolerated. Like I will say, I don't think I've really heard very few examples that patients taking an empty stomach have any concerns with kind of you know, just any issues taking the product on an empty stomach. So I think it's more from to mitigate any concerns around tolerance for the product that we recommend to take it with food. But in terms of efficacy, it's not at all impacted by whether you're eating or not. You know, in this space specifically, we'll see a lot of people that will, you know, fast in the morning, and again, they see just as good a results as people that choose to have breakfast.
Maybe you can mention it later. My last question was, could you talk a little bit about your topical product and what? Because we do a lot of skincare, and I'm just curious if, because I know a lot of absorption bypassing the gut might be better if you're trying to get high levels in the skin. Is there any incidence with aging in the skin? Because we know the microcirculation diminishes with aging, and smokers it diminishes, and people that are stressed and ill. So topical versus oral.
So yeah, I'll jump here to the topical product. So this is what you're essentially doing. When you think of the capsules, it's full systemic head to toe nitric oxide. What the topical product does is it delivers localized topical nitric oxide. So it's not, I wouldn't see it as an alternative, because you're really only able to deliver it at in a kind of a targeted portion of the skin. So again, for patients either looking for, you know, just circulation for addressing fine lines or wrinkles or discoloration, it works fantastically. Or if, like, we're not able to say this too outwardly, but if you're looking for, potentially wound healing benefits, that's also what you want to going to draw blood flow to the area of the scar. But how it works is you'll see here in the white, there's a white chamber and an orange chamber. So you might actually be able to see it that clearly on this photo, but there's two chambers in the product. One delivers sodium nitrite and one delivers ascorbic acid or vitamin C. You put a pump of each onto the surface of the skin, and then you mix them together. When you mix them together, what you'll start to notice almost straight away in the serum is you'll start to see bubbles forming. And those bubbles are actually nitric oxide gas. And what it does is the viscosity of the serum is such that it holds the nitric oxide gas at the surface of the skin. And after about 15 seconds, you'll start to see very, very distinct redness occurring on the skin. And what that is it's all of the capillaries vasodilating right at the surface. And at that point, it's kind of in the same way the testers, which we'll talk about, are quite demonstrable for the patient. This also is very clear that this is having a very distinct effect on the body. And you can leave that on there for 3 or 4 minutes. I generally tend to wipe it off at that point because it does have a slight amber hue to it based on the vitamin C. But once it's brought that blood flow, the job is done. Essentially, it has brought the blood flow. That blood flow is important in clearing waste, ensuring collagen creation, all of those benefits. But it does work best in tandem with the capsule so that you're delivering that kind of inside-out approach, kind of similar to, you'll see a lot of hair loss products that will have a topical and an ingestible. The inside-out approach kind of works really well for that.
Can I jump in, John, for 1 moment?
Sure.
Okay. Hi, Dr. Brun. I just wanted to interject.
Hi, Dennis.
I've been using the serum quite religiously on my face, and what I've noticed is, yes, you get really pink on your face. I don't wipe it off myself, but again, every other product that I put on after is absorbed better. My skin just looks healthier. It definitely is more hydrated. I've applied it around cuts that I've put, on my finger. It helps to heal those. We have so many studies on wound healing and anti-aging. So I can send all of that to Erica and she can share that with you after the call. I just wanted to introduce
That would be good because, in the aging patient or someone who's had radiation therapy, like to the breast area, smokers, they all have compromised microcirculation. So that might be a synergistic effect with their skincare products.
Yes. And I'll send that all to you so you can read through it. We have a lot of good data. Thank you, John.
Okay. One other thing about nitric oxide, as it kind of relates to some of the applications you may consider, is it is antimicrobial and antibacterial. So, it's just another benefit of using it in some of your use cases. And one other application for the serum, which is kind of more and more common as we see more and more of these locations come up and more practices offering it, is if you're trying to do an IV or trying to give a patient an injection, and you can't find a vein, by applying the nitric oxide serum just to the inside of the elbow, that oftentimes helps kind of make the veins more visible again because of the vasodilation that can occur. So that's not one of our more common use cases, but it definitely is something that we hear anecdotally from our practitioners.
Can you take the supplement while pregnant or breastfeeding?
So we haven't, I'll put it this way, we haven't tested it on women that are pregnant and breastfeeding. We are, I think next weekend, or maybe this weekend, we're doing a whole webinar on nitric oxide's role in fertility. And that webinar will cover people that are both trying to get pregnant, people that are pregnant. But in terms of our product specifically, we have not tested it. I will say the common way we phrase it is that if someone can eat a leafy green salad, they can take our product.
So it's like there's nothing that's in it it's vitamins and minerals. It's, you know what I mean?
That's it.
It's just, yeah.
It's essentially mimicking leafy greens. So if a person can eat leafy greens, they can take our product. And even kind of on top of that, a lot of people that have an intolerance to oxalates can't eat leafy greens, but they can take our product because it does not contain any significant amount of oxalates.
You don't test rubbing at one breast, not the other.
Oh, can you take this in addition to, what was the brand name?
Viagra.
Oh, Viagra.
Yes. So actually the call I have right after this is with a company focused on ED. So the thing to think about with Viagra or PDE5 inhibitors is that they are important in maintaining an erection. They're not as useful in helping get an erection. So in order to get an erection, you need to have adequate nitric oxide. So you'll see about 40% of men that use either Viagra or Cialis actually don't see the benefits that they expect. And that is because they don't have adequate nitric oxide. So I listed here as our second most, our second application, but honestly, it is what people are most motivated to take action by. And we have an absolutely huge number of men that will take Berkeley Life and their medication because they just want to throw everything at the issue. And we just got IRB approval for a study that looks at the combination of our product and tadalafil, which is the what Cialis is. So that is a huge application for our product. And we're also launching a case study on female sexual function, which should kick off here in the next week or so. Because again, female sexual function is very much blood flow mediated. Arousal, lubrication, sensitivity all require adequate blood flow.
John, so how does the nitrate in Viagra and those ED products is a vasodilator, and one of the side effects is a headache? How does the nitrate and nitric oxide work differently than nitrates? They both have a vasodilatory effect, but is there a different function there or what?
It's a great question. So one of the common things that are flagged to us, especially clinics that are focused on male sexual function, is you'll see a warning often that you shouldn't take nitrates with PDE5 inhibitors. What that relates to specifically is organic nitrates, and that's not how it's grown. It's more just like the chemistry of it. And organic nitrates are your nitroglycerins and similar, which are, when you consume them, they instantaneously create nitric oxide. What we're delivering here is inorganic nitrate. In the same way, spinach is also inorganic nitrate. And why that's an important differentiation is that the body it's very intentionally inefficient in how it converts that nitrate into nitric oxide. So you're not going to get an instantaneous burst in nitric oxide in the body. It's a very gradual process over the course of about 90 minutes. So yes, they have vasodilation benefits, but because the body modulates nitric oxide creation, you're not going to see an unsafe drop in blood pressure or too much circulation. How it works is that as the blood is flowing through the body, as it encounters any kind of obstruction or narrowing of the vasculature, it releases nitric oxide to signal the endothelium to relax. So it really is the case that as the body needs it, it will create nitric oxide and utilize it that way. But the challenge with a nitroglycerin is that there's no optionality there. It'll just create NO, because the primary use case of a product like that is someone that is, either has severe cardiovascular disease or someone that is actively undergoing a cardiac event. So that's the kind of differentiator, is the slow release of our product. So, and we'll talk about the test strip here in a minute. You'll see that when you test after taking our product, you wait for about 90 minutes, because that's how long it takes to be absorbed into the bloodstream, circulated back up into the saliva glands, and then start to get converted in the mouth. So the only way you get headaches by taking our product is if you took 8 to 10 capsules at a time. We have people that take 4 capsules at a time and have absolutely no issues. I don't recommend that, but it really is very well tolerated. And the headaches is probably the most I've seen, and that is, I don't know about you, Donna, but I really have only heard that once or twice.
So this would be safe in someone who was having, like, if they unknowingly had a cardiovascular event and went to the ER and they started on a nitro treatment. This wouldn't have, correct?
Yes. Yeah. No, there would be no issue at all.
Total way.
Slow release.
Yeah.
All right, thank you.
No problem at all. So again, these are all applications. I think I won't go through these in much detail. Again, just emphasizing the logical tie back to really all of these tie back into circulation. I'd say sexual function is something you're probably seeing. Cognitive function is, again, when you deliver more oxygen, more nutrients to the brain, you're going to see a lot more benefits. And there's also other kind of more signaling molecule-based benefits related to nitric oxide and cognitive function. And then exercise performance. So if you have people that are coming in that are, you know, what we call weekend warriors, like they're doing their 5Ks, their triathlons, etc., there's a really good use case for increasing or improving their nitric oxide levels around those types of events, or just generally in training to improve their cardiovascular output. So the test, I believe you received tests with your order, but I'll just walk through it a little bit now. And why this is really one of the things that makes our product unique versus really any other supplement, why the ones that you carry or ones that you consider, is the ability to demonstrate to your patients its impact in a very short period of time. So when you see the patient, how we recommend you kind of start the conversation is if they're over the age of 40, you know, as part of their normal workout, consider nitric oxide one of their vital signs. The test takes about maximum 15 seconds to administer. And it's as simple as putting the pad on, and there's instructions that will come with your shipment, but you put the test strip on your tongue, you take it out, you fold it in half, and you'll see a color reading similar to what's on the bottom of this slide here. The vast majority of your patients will be down at depleted or low. This is just a direct reflection of how much nitrate they've consumed in the previous 6 to 8 hours. And that's just, you know, I'd say I've tested 10,000 people over the last 6 or 7 years at various conferences and events, and just the majority of them are low, even when you go to medical conferences where people are logically slightly more healthy. So the good thing here is that, you know, it's something that the patient likely isn't aware of. They maybe didn't come into your practice looking for education on nitric oxide. But if you give them 2 capsules and then you retest them again in 90 minutes, they will see a dramatic improvement in their test results, which, as you know now, is an increase in their nitrite levels. So depending on the circumstance or how long a patient visit is, if they're there for, you know, anything close to 90 minutes, you'll be able to test them again before they leave. Or if not, you can send them home with a test strip and just make sure they set an alarm on their phone to retest within 90 minutes.
Yeah.
The best practice then is that the patient will just text in an image of their repeat test. The one thing to remember for the test is that you shouldn't eat or drink in the 15 minutes before doing the test. So why is that? Is because you're measuring the potency of nitrite in your saliva, and by even drinking water, you're diluting your saliva and giving yourself a false reading. So that's just one thing to consider as patients are doing the test, is making sure they haven't eaten or drank 15 minutes before doing the first test or the retest. But again, it helps the patient educate them. It helps validate the efficacy of what they're doing. It helps demonstrate that they have a need for nitric oxide. And then if they want to go the dietary route, still no harm for them to do the test based on what I shared earlier about how some foods actually don't contain the nitrates you may expect. So for that reason, it's always good to, you know, have them continue to test even if they're going the dietary route. Any questions on the testing? Because this is kind of what is a real advantage for you as a clinician or clinicians in educating the patient. But anything that, you know, you're unfamiliar with or unsure of as it relates to doing the test?
But will any medications patients typically take affect the test results?
So the only thing to highlight, so if the patient for whatever reason is taking are using chlorhexidine, so chlorhexidine is prescription mouthwash. The reason for that is that in order to convert nitrate to nitrite in the mouth, you need to have adequate oral microbiome. Chlorhexidine is the one thing that's been proven to just wipe out your good and bad bacteria in your mouth. So those patients will not show any change in the test strip. And there's more impacts that using something like chlorhexidine has. Like there was a study that was done on college age students using chlorhexidine for a very short period of time. I believe it was 2 weeks, and they saw an increase in their blood pressure in that period of time. So that the importance of your oral microbiome, in the same way your microbiome throughout your body, is critical. The other thing is you'll see for patients that are maybe on long-term antibiotics for exactly the same reason. Those long-term antibiotics will have disrupted their oral microbiome to the extent that they can't convert nitrate to nitrite. Kind of not necessarily related to your oral health, but other things that affect the body's ability to make nitric oxide are PPIs, so proton pump inhibitors, because they affect the acidity of the stomach, and the acidity of the stomach is critical in converting nitrite to nitric oxide. So what you're doing at each step, so you consume nitrate, which is NO3, that converts to nitrite in your mouth, which is NO2. And in order to lose that last oxygen molecule, you need the acidity in the stomach. That's why we use some vitamin C in our product. But if a patient has chronic PPI use, they will struggle to make nitric oxide because of that. There are other papers, and I believe I won't try and explain because people smarter than me have done white papers on this for us. But there are also impacts of non-steroidal anti-inflammatories, so NSAIDs. There's also concern around aromatase inhibitors, like things that are used for hair loss, and those can also affect the ability to create nitric oxide. So there are quite a few things that will affect your endogenous nitric oxide production. Some of them will affect how our product works. Others just affect your endogenous production. So something like aromatase inhibitors, they won't affect how our product will deliver nitric oxide, but a patient that is using them will oftentimes be experiencing the symptoms of low nitric oxide.
You know if there's any relationship between, are you familiar with sulfonaphanes that are in like sprouted broccoli? Sulfonaphanes, there's a lot of research about that being one of the best nutrients in green leafy vegetables. Is there any relationship between sulfonaphanes and nitrates?
There's not, but we do have sulforaphane in our cognitive product. So my primary understanding, this is a newer product, so I'm kind of getting us more familiar with it, but the primary applications as we use it here is as an antioxidant and anti-inflammatory, but they're related in that they both come from leafy greens, or from greens, I should say. So sulforaphane, at least the primary source of our sulforaphane is broccoli. But if we refer back up to this graph here, you'll notice that broccoli, it's not on here, but broccoli is on the far right of this graph. Oh, no, it's in the middle. So there's not as much nitrate in broccoli, but you're right, it does contain very high levels of sulforaphane, which has a lot of benefits as it relates to acting as an antioxidant to the body and also acting as an anti-inflammatory.
Great, thank you.
No problem. So we do offer these kind of conversation snippets. I do want to just jump down here, and I know Donna probably has taken care of you guys as it relates to the support kit. So really, I think over the last 12 to 18 months, I suppose from 2017 through 2020, we spent a lot of our time on the more scientific clinical information of nitric oxide. So, use cases around inflammation, around cognitive health, really kind of meaty white papers, if you will. And what we've learned over time is that we need to support practitioners and their teams with the materials that they can give to their patients that will educate them on nitric oxide. So over the last 18 months, we've done a lot more work on patient bifolds as it relates to blood pressure, cognitive health, neuropathy, all of these things, just to take some of the load off you guys and how you explain nitric oxide's role. We have some signage that you can utilize around the office that will prompt the patient to ask for nitric oxide based on some of the symptoms that we highlight on that signage. We have in-office video loops, though, if you want to put up information via videos that are all captioned, you can do that. So a number of different ways, and we're constantly iterating on these based on feedback we get from your practitioners. So I'd make sure to work with Donna to say, explain a little bit about the layout of your practice, what you find useful, because more often than not, we've thought of it, but we have something that will be perfect for that use case. If you're dealing with patients maybe remotely, we have the ability to ship them test strips as part of their outgoing shipments. They do the test at home and then call you if they're depleted. That's probably one of the most impactful pieces we've ever developed. So a lot of different ways that you can educate on NO, and because it's so relevant to really the majority of your patient population over 40, you can kind of educate broadly and assume that there will be benefits. Similarly, kind of in layout, I would, based on your website and kind of doing some research, I'm sure your waiting rooms and treatment rooms are very well laid out, so I don't need to share how you do that. But also recommending keeping an eye, and I know Donna will be proactively sending you these things, but keeping an eye on our website. We're constantly publishing new information, new content, new patient resources. So keep an eye on your email, keep an eye on the website, and we'll be able to share with you, what is the latest in nitric oxide research and different ways that can be applied in your practice. And as I said, we have the upcoming webinar. I believe it's this Saturday. I haven't been involved in it, but that's all around fertility, all from conception all the way through to having a healthy baby. So that's I've never seen anyone else talking about that. That's one of the more innovative applications.
Real quick,
inbox.
can I interject, John? I was going
Of
to say,
course.
if anyone is interested, I can send you some patient videos that are on a loop so they can educate your patients on nitric oxide, and I'll send those over to Erica. I have a number of things to follow up with after the call. So
Yeah, that's amazing. Thank you.
perfect.
And I don't think it's as relevant to you based on against looking at your site, but we do have the ability to ship patients directly. I think you have a fairly well developed e-commerce portion of your website, but if it's ever of interest, we can provide you with a unique link. You'll send that to your patients. Your patients can order from us and only with that link, and then they're associated with you in our system, and then you will get a margin, a 30% margin on that. So if at any point that makes sense, please reach out to us and we'd be happy to set you up with that. So I'll just jump back to the products here quickly. So this is the primary product, the nitric oxide foundation. Again, as I said, standard dosing, 2 capsules once daily. The box will say to take it with food. That really is, you know, I wouldn't say necessary based on all the experience that I've had, but if patients are very sensitive, maybe no harm to suggest that they do so. It's $49.99 for a 1-month supply. Situations where you might want patients to take more than 2 capsules a day is if they're taking the product for sexual function. In that case, it's 2 in the morning and then 2 as best they can time, about 90 minutes to an hour before sexual activity. And other scenarios would be someone that has very high inflammation. So if a patient, for example, is taking it to address some neuropathy concerns, 2 in the morning, 2 in the evening for the first 2 weeks is really preferable because you're dealing with a lot of inflammation in that scenario. The formulation itself is very similar. I kind of draw your attention here at the very bottom. The proprietary blend is the source of nitrate in the product. And the best way to equivalate this for your patients is 2 of our capsules is the equivalent of 5 ounces of spinach or 7 ounces of beets. If you put 5 ounces of spinach in a bowl, it's a lot of spinach. So as I said before, not many of your patients are consuming that on an ongoing basis. You have the vitamin C, as I've referenced, which is important in the breakdown of nitric oxide. And again, magnesium, not a whole lot of magnesium. So I would suggest if you're offering it to a patient for blood pressure, that they're recommended kind of another magnesium product to supplement that as well.
Joining now. Okay.
When it came to the B12, that was a pretty high percentage. Does that mean a patient won't have to take B12 individually?
No, I think the patient shouldn't need to take additional B12 with this.
Okay, that's good to know.
The serum we've talked about, the cognitive support, again, is new to the product line. And the logic really here is that we're improving circulation head to toe, including cerebral blood flow. So the idea is that if you're putting these clinically proven nutrients for cognitive function into the body and they'll get to where they need to go in the brain. This product, the formulation has been proven for psychomotor speed, for short-term memory and for processing speed. So it is beneficial not only for kind of long-term cognitive function, but it does have a benefit for short-term alertness as well. And that's just 1 capsule a day. So I don't believe you started with that, but if you're interested in adding a cognitive product, it's a really, really great product that we can offer. I'll just run through these in the time that we've left. So how often do people need to test? I really recommend if they do the before and after and they see an improvement, they don't necessarily need to test much beyond that. The only scenario will be patients that are taking the dietary approach and want to make sure that they're measuring on an ongoing basis. Contraindications, again, really well tolerated as a product. The only thing that we flag is that patients that are on blood thinners, we recommend they start with 1 capsule a day and then increase based on their comfort levels with that. We haven't had any issues with it, but we always try to be extra cautious. And similarly, with patients that are kind of actively undergoing chemotherapy or cancer, we recommend we wait until after they're done before taking the product. So again, we talked about this third point. Patients absolutely get the same benefit from leafy greens. The cost is $49.99. The comparison, as I mentioned, the primarily other products are arginine and citrulline based. And in terms of other nitrate products, we deliver the most nitrate per 2 capsule dose. So patients are going to see the best benefits with Berkeley Life. And then the last one, can they access the product without going to the practitioner? We are a practitioner only brand. They can access it without going to you, but they need to have your unique link in order to do so. I've about
what are the most common side? If you're going to see the side effects, I understand they're infrequent, but what would be the most common ones?
Honestly, headaches. Headaches is the only one that I've seen, and that's been honestly more personal that I've had that, and that's just because I go to conferences and we tend to try every nitric oxide product at the conference, and I end up getting a headache. Side effects other than that are, I wouldn't say anything bad. I can't think of anything else. I'm not being cagey. I just don't really have any other side effects that I can remember or I can think of. Anything that you've come across, Donna, that I'm missing?
The only thing I've ever heard is if someone's very sensitive, maybe a little bit of nausea, we have them take it take it after food, maybe start with 1 capsule and increase to 2. That's the only other thing I've ever heard, but you have to take 2 capsules in order to get a physiological effect according to the literature. So 1 capsule is not enough for a dose, just so you know. But yeah, that's it.
What about other medicine? You had mentioned blood thinners, but is there anything else that you have to be conscientious of taking with this particular product?
No, blood thinners, and as I said, any patients that are actively undergoing chemotherapy were the only things I would flag. The other thing I had at the top of my head, so if a patient is on, say, an existing course of medication that this is designed, Berkeley Life has the potential to replace. Again, we don't recommend they stop taking anything. It's more of a case of if they're doing it for blood pressure, they monitor their blood pressure. And if they start to see a decline, then they can talk to their doctor about reducing their medication. Similarly with neuropathy, if they're on like a gabapentin, stay on it and then add Berkeley Life. So it's always initially, at least, as an addition. And then if they get to the point where they're comfortable and their doctor approves, they can consider coming off whatever medication they're on. But, you know, really, again, I know it's said it before, but if the patient is allowed and comfortable eating leafy greens, then on whatever medication they're on, then they can take our product. That's kind of the simplest way to explain it.
What's the issue with blood thinners? I don't remember you mentioning that was a problem. Is there a problem with some blood thinners or not?
It's I wouldn't say there's any kind of documented problem, but anytime you're increasing potentially increasing circulation for someone that has some type of blood thinning concern, you know, we just want to be ultra cautious. So there's nothing in the literature that will say it should be avoided or needs to be avoided. But kind of we're just thinking of the most, we're kind of always on the most conservative end in terms of our recommendations, and might not seem that way in terms of how few side effects we're referencing. But blood thinners is one of those things that we just try to be ultra cautious. I can ask our clinical advisor and see, does she have, you know, a more elaborate answer to that. But my understanding is it's just an abundance of caution, really. And as I said, the majority of patients that start at 1 capsule will increase to 2 capsules without issue within about 2 weeks. Did you have something else, Donna?
Sorry to interrupt you. I have an email written by our educator, Beth Shirley, on Coumadin. It's short, but it just kind of covers her suggestions on how to take NO with it. So I'll send that to Erica after the call. I'll get that all the information to you, Erica, by the end of the day today.
Awesome, thank you. Can we also get a copy of the recording? We have a couple of staff members who aren't here, so it'd be nice if we could send it out.
Yeah, yes, just John will send that to me and I'll get it over to you. Absolutely.
And those videos that we can get on some of the TVs that are in the treatment rooms, as well as in our reception area for people to watch and get education.
Perfect.
Absolutely. One last thing to tell you is with ED, erectile dysfunction, we get results so fast. So you'll see if a man gets on this product, usually within a few doses or up to a week, maybe he's telling us, oh my God, what is this stuff? You know, so you'll see fast results with that application specifically.
So again, I'm conscious of my time here, or our time. If it sounds like, you know, you've a few different ways you might consider applying the product, I definitely would encourage you, if you want to do a follow-up of just a pure Q&A, I'd be happy to do that with you all. So
thank you.
Take it away, watch it, start to utilize the product, work with Don on the marketing side. And then as more questions come up, as they inevitably will be as you talk to patients, either shoot the questions across in an email or we can jump on another call, and I'd be happy to run through this in more detail.
That would be great. Thank you so much, John.
No problem. Thank you all for taking the time.
Thank you. Have a wonderful day. Thanks, Donna.
Take care, guys.
Bye. Thank you,
Bye.
everybody.
Like, I looked at it.
Bye-bye.